split and slide, so it's not applying a direct arthrokinematic glide. So in my schooling, the arthrokinematic glide is a directional mobilization. You're doing a directional mobilization that's consistent with arthrokinematics. Okay? So your gapping is not technically along the arthrokinematics. Because what you're trying to do when you do the gapping is to just kind of create space in the area. You might utilize it as low level, like the distraction, when things are more acute and you just want to start to get some stimulation to the area. For the extension, the anterior gapping, posterior gapping, you will do it direction specific. If someone's lacking extension, someone's lacking flexion. But when you try and do the directional glide, it's like you just can't get it. You're trying to do the directional glide, and it just doesn't feel like a clean glide. You're not getting what you want out of the glide, so you default to the gapping. You do the gapping to sort of create space in the area. It's in quotes because you're not really creating space, but you are gapping it. So you're opening it up. You're trying to get some of the congestion out of the area so that you can have a more successful directional glide. If you're having a neuromuscular effect or a direct articular effect, doesn't really matter, but it does change the environment so you can get a better directional glide. Okay. Yeah.
So there were you anterior gapping to gain more posterior directional glide?
So here I'm anterior gapping in order to gain flexion.
Okay.
Okay. So think of it that way, but you're not wrong in what you said, because I'm going to do anterior gapping to create space so that now I can gain flexion. And the directional glide that I'm doing is a posterior tibial glide, right? Because that goes along with flexion. Okay? We just have to clean up to clarify which bone you're talking about.
If it's similar to distractions, will this help as well if they're guarding?
Yeah, it will.
Okay.
Yeah, so the distraction, in general, a general distraction, and you wouldn't even do it at the motion barrier. You could, but you can do it away from the motion barrier. Doing it grade 1 distractions are a great technique to create that neuromuscular quieting. So if there's pain in the area, that's a nice soft technique to start to calm things down so you can get into it. When you're trying to gain range of motion, then you definitely want to be at the motion barrier. But you could still utilize these techniques if there's pain. But it's more aggressive than a general distraction. But you could do a milder gapping in order to try and create a neuromuscular quieting in the area. If you're going to do it specifically to reduce guarding before you do your directional glide, that's what I mean when I say I don't know what the actual effect of gapping is. Is it an articular effect or is it a neuromuscular effect? The neuromuscular effect would be it quiets the muscle spasm so you get a better directional glide. Right? So that doesn't matter. I mean, you're improving your ability to get your glide.
Yes.
Okay? Okay. Now, for the tib fib, you're going to assess the posterior glide of the fibula on the tibia. Okay, so you bend the knee, and you can stabilize the foot. I'm gonna move out of the way, so I can stabilize the foot in order to get the glide. I'm moving out of the way. So I'm getting out of the way. So imagining the foot is stabilized. I'm going to stabilize the tibia with one hand, and I'm using my thenar eminence on the anterior part of the fibula. Okay? And I'm going to do posterior glide of the fibula. But the angle of the fibula is not direct posterior, so you're angling your glide posterior medially. Okay? Conversely, when you do the anterior glide, which we'll do in a moment, you're going to glide anterior laterally. This is the direction of the joint. Okay? So I'm set up here. So I've set up my position. Headlights are facing in the direction of my mobilization. ASISs are facing in the direction of the mobilization. Stabilize the tibia. I hug the thenar eminence on the front anterior part of the fibula. I stabilize, and then I weight shift, and I get my posterior mobilization through the forearm. Notice the forearm is in line in the direction of mobilization. Okay? So I create the solid unit, stiffen the wrist, and then I'm able to do the weight shift to get my mobilization. Okay? You can do your anterior glide here. Again, you would stabilize. No, I'm not. And I have my hand on the tibia, and then I can pull push my hand posterior on the fibula, and I'm going to mobilize anterior laterally to gain anterior lateral motion. Okay? So that's one technique that you can utilize there. Another technique that's popular is the side lying one. Go ahead, lie on your right side. Bend both knees. So I can position here, so that I can get, I do tend to use the thumb over here. This is, you can go direct onto the posterior part of the fibula. So I'm using the hypothenar eminence here. You can position your thumb on the posterior part of the fibula and then use your hand over your thumb. So this can get a bit more direct pressure. So I'm technically not using my thumb to get the mobilization. I'm using my thumb to get a more comfortable contact onto the posterior part of the fibula, and I'm using my hand to be able to get that mobilization. Okay, so my fingers are stabilizing the tibia, and then I'm pushing, but again, you're thinking about that anterior lateral direction. So you're almost doing this kind of motion. Okay. That's it. Cool. All right, so try those. Yep. Here, lie on your back. Keep the foot in neutral. Okay. So the nuance of it is that the tibia rotates, and you should get motion in the fibula. So in order to get the full glide, I will induce an associated tibial rotation. All right. So I wasn't going to talk about that, but that was part of what you were saying. Okay. So just do your straight anterior posterior glide, but of course it's an oblique angle, and then ignore what I did with the tibia. It's not typically done that way. It's a little harder to stabilize, and I don't know.
Yes.
I don't know of a reason why I would do that.
I'm just curious because you did anterior glide.
Yeah, you do anterior glide, and what I'll mention in a moment, part of the reason you do that is because you can use the foot along with it.
I hate myself.
Why would you do this?
So the fibula, so you do the fibular glide.